Welcome back. There's nothing like hearing the heartbeat of that baby while you are pregnant. And if a sign of anything unusual is detected, Spectrum Health has an amazing team in place. And here to talk more about it is Dr. Jeffery Schneider, Pediatric Cardiology with Spectrum Health. Good morning. Thanks so much for being with us.
Thank you for having me on this morning.
Absolutely. So go ahead and tell us a little bit about the Congenital Heart Center and what you guys offer parents in terms of fetal heart care.
Oh, okay. I'm a pediatric cardiologist in the Congenital Heart Center at Helen DeVos Children's Hospital, and I have a special interest and expertise in the care of the before they're born. The field is called Fetal Cardiology, and my colleagues, Dr. Sawinski and Dr. Summerfield, and I specialize in the diagnosis and management of all manner of heart problems before a baby is born. These could range from structural birth defects of the heart, heart arrhythmias, sometimes virus infections of the heart, complications from diabetes. We work also closely with our neonatology colleagues and with our colleagues in the maternal fetal medicine clinic.
And so how common are these fetal heart conditions that you speak of?
Well, birth abnormalities of the heart, we're talking about birth defects of the heart mostly. And we know that about 1% of babies will have a birth abnormality of the heart. That translates to about 40,000 babies in the United States every year. Mm-hmm. About a quarter of those are the ones who have more serious or critical congenital heart disease of the type that would require procedures or surgeries within the first year after birth and sometimes within the first week after birth.
So what does care for these conditions kind of look like?
Well, care for babies with congenital heart disease starts with a prenatal diagnosis, hopefully. That's what we do. That allows for preparation for us to gather the necessary personnel and equipment so that we can be ready and waiting for the baby at the time of birth. The sickest of the babies who have serious problems with the circulation right at the time of the birth, they would go to the neonatal intensive care unit where we make preparations for heart procedures or heart surgery.
And so we hear the word preventative a lot. So how important are these screenings for mothers and for the unborn child?
Screening basically begins with a thorough history, and then the fetal echocardiogram which is an ultrasound method, is our main tool for detecting birth abnormalities of the heart. For the history, we would ask the pregnant woman about prior children with congenital heart disease. We would ask, does she herself have a birth defect of the heart? Does the father of the baby have a history of a heart defect? We will also ask for other risk factors such as maternal diabetes or genetic abnormalities, certain medication exposures. But the fetal echocardiogram is our main tool for diagnosing babies with birth defects of the heart. That test is typically done at 18 to 24 weeks gestation, and we work with experienced sonographers who actually do the hands-on scanning. We sit by their side during the exam, and we go back and forth to really take a detailed look at the baby's heart. This is a little bit different than the typical ultrasound that women have at usually 18 weeks, where the sonographers look at the baby from head to toe. Our exam is tailored to specifically look at the heart and circulation for the full 30 to 60 minutes.
Wow. So no doubt this is definitely a special program to have right here in West Michigan. So we thank you so much for your time. We are running out of time, and we're going to learn a little bit more about this by simply going to Fetal Heart at the Congenital Heart Center at Helen DeVos Children's Hospital. Head to spectrumhealth.org. So spectrumhealth.org, just type that in and you guys can learn more details. Dr. Schneider, thank you so much for your time.